Hi, this is Dr. Michael Ryan with Missouri Vein Care. I'm answering a question people ask me, which is, how do I know if my leg pain or discomfort is really a problem, is something I should worry about? And that's kind of a big question, but I can tell you that there's two main categories of leg pain that makes one become concerned. One is that pain that you get when you're walking. If you get pain in your thighs or even your buttocks or your calves when you're walking, that could indicate an artery blockage problem called PAD, peripheral arterial disease. The key with that kind of symptom is it occurs the same time when you walk. Every time you walk, it's the same distance, and it's usually worse when you go upstairs or up a hill. If that's the case, the next step would be to get an artery ultrasound to get that sorted out. Another category of symptoms that is not normal is to have leg pain and aching in the evening when you're just sitting around and you're not doing anything. Because people can understand if they're active, they're doing chores, they're exercising, their legs can hurt and ache. But when they sit down and they're not doing anything, their legs really shouldn't ache and hurt. That usually is an indication that there may be a vein reflux problem. That's venous insufficiency. And what's going on there is that the vein circulation is stagnant and it's letting this inflammation build up in your legs from the stagnant blood flow. That is causing an aching, throbbing, kind of a deep kind of discomfort. People often don't even say that it's painful, it just throbs and aches. But it's bad enough that people sit around and they don't want to do anything. So it really is pretty significant. Ultimately, when people have that kind of symptom, and that is actually the most common symptom that develops in a vein condition as it gets worse every year, people will begin to sit around, they're not burning as many calories, and they gain weight. And that is not very healthy. So this is Dr. Michael Ryan answering the question, when is leg pain really abnormal and when should I worry?